And the World Health Organization says it is monitoring a new COVID-19 variant that's been spreading in Asia and leading to a spike in hospitalizations in China. Now, this new strain has also been detected in the US. For more on this, I'm joined by Deakin University Chair in Epidemiology, Professor Katherine Bennett. Good to have you on the program with us. Katherine, now this new strain of COVID, it's called NB181. It's been responsible, as I mentioned, for a spike in hospitalizations in China and now even the US. What do we know about this new strain?
Well, it's been around since early in the year, since about January it was first reported, but it has seen a rise not just in China but in Asia. It's actually spreading through most countries now, and it's been in Australia since last month as well. We had a pretty mild last wave. Even in the Northern Hemisphere, the winter wave wasn't as severe. And so we might have got away with that. Certainly with us, our summer wave really didn't have the same impact. This variant is still related to the same family of variants, the JN1 that we saw driving some of that infection in our winter wave and then through the end of the year. But it's a new variant. And the reason they're watching it closely, the World Health Organization's deemed it to be a variant under monitoring, is because it has this combination. It's able to evade our immune response because it's a bit different. It's got these new mutations. But also it looks like a strain that's particularly good at latching on to the receptors in our respiratory symptoms. So if it's going to cause more infections and it's easily spread, those two things actually mean we have to watch out for it, and particularly as we go into winter. The symptoms, the disease doesn't look to be more serious, but if you get a lot more infections, we could see more people very unwell. And that's why the booster is going to be very important for us going into winter, particularly for people still at risk of severe disease.
Yes, if it does, as you say, evade immune responses, should the general public be somewhat concerned, as well as health authorities in Australia?
Well, they'll keep a close watch on it. We'll watch what's happening in the countries where it's spread earlier. We've already seen it in New South Wales. It's being detected in the sewage water in Western Australia, and it's now the most common variant. So we're already experiencing it, and they'll watch it closely. The good news is that it's descended from the JN1 variant, and that's what our vaccine is based on at the moment. So the vaccine isn't a perfect fit because the virus has moved on again, but it still works to particularly prevent against severe disease. And that's the most important thing. We want to keep people out of hospital if we can, particularly if the infection rates start to really pick up over the winter period.
Yeah, yes, I mean, you did say that we possibly had it easy in the last wave. Would you expect that things might be different when winter arrives?
Well, we always worry that a winter wave could be worse just because we spend more time indoors, you're socialising indoors more often. All those things, the atmosphere, the humidity, they're things that the virus enjoys, and respiratory infections generally do better in winter for the virus, not for us. So we do worry about the numbers going up over our winter break, and we do want people to be really careful to make sure that they're not that they're up to date with their vaccines, particularly in Australia. People over 65 are recommended to have an annual shot. People over 75 or anyone immunocompromised is also encouraged to have those boosters. So it's good to protect ourselves going into winter with this new variant starting to push case numbers up.
Yeah, so as this new strain takes effect and spreads, in the US, we're now seeing that the Trump administration is removing recommendations for pregnant women to take a COVID-19 vaccine. Are there dangers in this for women who will be having children?
Well, we know that the vaccine is safe for women in pregnancy. We know that particularly earlier on, when we didn't have good immunity in the population, that actually the vaccine was quite important to help pregnant women get through to a safe end to their pregnancy. In Australia, we don't recommend, but women of any age, 18 and over, are eligible for a vaccine. And if someone's pregnant, we encourage everyone to talk to their doctors. So while it's not recommended for people in that age group who would be pregnant, they are encouraged to talk to their doctor, and they're eligible for a free vaccine if that's the right choice for them.
Yes, and just in the US, we are seeing hundreds of people who are still dying every week from COVID. Does this surprise you in any way? Or is this rather the new normal, since the pandemic?
It's hard to say the new normal. So in this administration in America, what we are seeing, unfortunately, is a top-down resistance to vaccination. And so we're getting that message through. I think even the way these recent announcements were made, usually it doesn't come from the Secretary of Health and Human Services. It doesn't, usually it involves the experts that sit within the CDC over there. They actually have an advisory group on immunisation practice, and we don't know how they've been engaged in these conversations. And we know they've got a problem with measles at the moment. So if we're going to see a rise in these vaccine-preventable diseases that are causing severe disease and deaths, sadly, in some situations, then it's really important that right from the top down, there is clear messaging to the public about balancing those risks and making sure that they've got the right information to make informed choices.
Okay, Professor Katherine Bennett, always appreciate your insights and expertise. Thank you so much.
Thank you, Girish.